Hello, I'm Annemieke Aartsma-Rus, and I would like to share with you some information on how to best use your animal model. And I think the first thing to know is how to choose the best model and how to ask the right questions to your model is to first study the model. And that makes a lot of sense, and that's what we do in patients, where we often do natural history studies of the patients. However, it's equally important to do this in your animal model. So you need to study the pathology, which issues are affected, when does it start, is it progressive, etc. You need to study function, if there are the functional deficits compared to wild type. And only if you have this information do you know when to best intervene and which outcome measures to use in your animal model. And just to give an example, patients often are diagnosed once they develop symptoms and once pathology starts. So if in an animal model you treat before the onset of symptoms, then you're not really doing what you will do in patients. So you need to know when the pathology starts, when functional deficits start, to then also optimize your intervention to best reflect the clinical situation in the patient. And when you do your natural history studies, you will also know the limitations of your animal models. Maybe a certain tissue that is affected in humans is not affected in your animal models. You need to know these things because then you can ask the right questions to the right model. And just one example why it's important to know your model is this. So this is a mouse model for Duchenne muscular dystrophy, and the MDX mouse in the diluted black agouti, the DBA background. And in regular MDX mice, because the pathology is less severe than Duchenne muscular dystrophy, you can breed these animals so that both males and females are affected. So it's X-linked. Normally, only the males are affected. Because it's mild, the males can have offspring, and then you get homozygous females. So both males and females are affected. Now, why is it important to do your natural history and not just use both males and females in your studies? Is exemplified here. So this is a two-limb wire test where mice hang for up to 10 minutes. They hang on this wire, and if they are able to, they can bring their hind limbs and their tails also on the wire, but this is their starting position. And what you can see is wild type, so the light blue lines, the DBA, males and females, they can hang for 10 minutes. They probably could hang for longer, but after 10 minutes, we stop the experiment. If you now look at the mice without mouse dystrophin in this background, what you see is that the females do a lot better than the males. Now, this is important information to know because if you do a study and you use 5 mice per group, and in the untreated group you have 3 females and 2 males, and in the treated group you have 3 males and 2 females, there will be differences because you can see this difference. There will be just differences just because of the gender. So you really need to make sure that you know this information, and then you plan your studies with either only males or only females, or a mix in such a way that it's that is properly balanced, and that you can draw conclusions for both just the males and just the females because the numbers are big enough. So we use animal models, and primarily mice. We use them because we can do a lot of things that we could not do in patients. For instance, we can, in Duchenne models again, we can analyze all the different muscles, including the diaphragm and the heart, which you generally don't study in patients because you can't get biopsies there. So what can you test? So you can test the histology, what I just mentioned, all the different tissues, but of course you also have to study function. And then the question is this relevant for patients? And of course, this hanging test that I just showed, well, that is not relevant for patients per se, because patients will not hang on a wire. However, it is a measure for endurance and muscle strength and muscle function. So in that way, it is relevant. The functional tests need to recapitulate the pathology. So if there's respiratory problems, you measure respiration, etc. And of course, what you measure needs to fit with the mechanism of action of the drug. If you think this drug will improve strength, you need to study strength. If you think, well, this drug will improve endurance, you need to study endurance. But in a mouse model, don't only test function. You have the unique opportunity to also look at histology. So that needs to be done. And then there is the thing that we have all these functional tests, but in the past, for instance, this wire test, there were different groups and everyone had their slightly different way of doing it. And that meant that if I had a result and someone in London had a result using the same but not identical test, and someone in Italy had the result, we were unable to compare this because we knew there's slight differences in how we conduct these tests. So what's important is standardized operating procedures. And TREAT-NMD the network has really done a big job in generating standardized operating procedures now for SMA, congenital muscular dystrophy, and Duchenne muscular dystrophy. And they have been generated by working groups. And the way it works is that not because people will want standardized operating procedures provided everyone uses their protocol. But that's not what happened here. So everyone doing the test was put together in a room, and then point by point, we went through the protocols, like, why are you doing this? Why are you doing it like that? And what would be the best way? And are there steps that may be obsolete, etc. And then coming to a standardized operating procedures that really is aligning with what the group jointly feels, and that now allows you to standardize between different groups.